Thank you. For Senator Feltus first. Mental health and substance abuse are often intertwined, but this next question is about people who are in a mental health crisis. While the state has done work to reduce the number of people housed in emergency rooms while in a crisis, it is still happening, with the state recently seeing an uptick in the number of cases. How can this be prevented? Senator, what could you do on your first day to stop this from happening?
Well, thank you, John. And there are people waiting in emergency rooms for needed, timely, and necessary mental health treatment. You don't wait if you break your leg. People are waiting for mental health treatment, including kids. 23 kids last week waiting in our emergency rooms for needed and timely mental health treatment. And John, we actually put measures into the budget and funded them to deal with this. Community mental health services, including a statewide mobile crisis intervention and stabilization team for children in distress needing mental health treatment. And Sununu has failed to stand it up. Literally, failed to stand it up. And that could have prevented those 23 kids from waiting in emergency rooms. So on day one, we're going to stand up the services we funded in the budget. And when I talk about the budget, and I talk about people not having experiences on the budget, including Andrew, this is what's at stake. We need this budget to work for ordinary people and to deal with the behavioral health crisis and to deal with people left out and left behind. That's what I'll do on day one.
Counselor?
Thank you. So I work as hard as I can to talk to people who really understand these issues. Dan's right about the Mobile Crisis Center. I was talking to community mental health center leaders the other day, and that was one of the things they pointed out as missing. But that's only part of the problem. We have about 70 people in ER boarding right now. Here's what the state's done. They said it's the community hospital's responsibility that the people are there. That's what they did in their federal litigation. That was misleading and wrong. What we need to do is stand up right away community halfway transition facilities so that we can discharge people who are being held at the hospital who shouldn't be. We can do that at the Sununu Center. We could do that at the Doobie facility in Laconia. We can do it at the Philbrook Center. There are places we can use for that purpose. We should do it now and get those people out of the emergency rooms.